without further ado, I'd like to introduce you to our executive director. Since 2007, Dana Hooper has been executive director of Life Services Alternatives, or LSA. That's the past 16 years, but his journey started many years ago when his son, Brent, was diagnosed with an intellectual disability. Over the years, he's become involved in many areas of the IDD world. He's become a leader in our community, working with government and nonprofits such as Branch Services, where he's currently a board member, Lighthouse for the Blind and Visually Impaired, who's their past board president, or past board member, I should say, and the State Department of Developmental Services, and in the San Andreas Regional Center, where he's a past board president, and currently where his son, Brent, is a client in supported living. It also led him to his leadership role at LSA, where he can make a difference every day in the lives that LSA serves. Thank you so much for joining us tonight, Dana.
Thank you, Adia. I'm so very glad to be here. And it's my pleasure to introduce Jim White. Jim is one of the driving forces behind Willow Commons, Portola Valley's first affordable and supported housing project for individuals with intellectual and developmental disabilities. It was inspired by his daughter and driven by a commitment to inclusivity. Jim and his wife, Patty, spearheaded this project to address critical housing shortage for this vulnerable population. It's set to open in 2024. Willow Commons will provide 11 multifamily units and 2 on-site staff units, offering a supportive community environment. With over 25 years of experience in the technology industry, Jim has a distinguished career as a venture capital investor and a former partner at Sutter Hill Ventures. He has a proven track record of guiding successful startups and is currently a fellow at Stanford's Distinguished Careers Institute. Through Willow Commons and his extensive philanthropic efforts, Jim continues to champion innovation and inclusive solutions for adults with IDD.
Thank you, Dana. That was very kind of you, and it's great seeing you again. Thanks for putting these things on. This is fantastic.
Well, thank you for being here. It's a great seeing you as well. We're going to start the fireside portion where I'll ask Jim questions and we'll get to hear from him the story. Let's get started. I guess first question, Jim, is just to frame the discussion. Maybe you could just briefly describe Willow Commons.
Yeah, so Willow Commons is in construction right now, but the intent is we'll be opening what we call an independent apartment community. And it's essentially be individual apartments for about 16 adults. We'll have a extensive kind of community building for programming, kitchens, multi-purpose, and in fact, a community coffee cafe. And the intent is to create a model that allows for independence, but as you know, trying to address some of the problems around service provisioning and kind of the scale and specialization that sort of is needed in many of these cases.
Well, fantastic. I understand Branch Services is a separate independent service provider. Briefly, what is Branch Services?
Well, so I mean, supportive. If you think about what the problem for many of our people we care about that have intellectual or developmental delay is if they want to live independently, they generally need some set of supports around that to help them be successful, not just in their living, but also in really fully engaging in the community, whether it's through jobs or hobbies or education or other things that they're pursuing. And people tend to focus on the supportive housing. I say there's 3 components. It's permanent, affordable, supportive housing. And you've got to kind of make all of those work. Our laws make it a little tricky, our rules, that you can't kind of commingle services and support and housing. But yet that's probably one of the root problems of how do you cost effectively deliver services. And so, yeah, we worked with the group, as you know, with Brenda Bacecki, who founded Branch Services. There was really a lack of service offerings for supported living services, independent living services in the Mid-Peninsula. And if we didn't like help support getting something like that started, I think even if you built Willow Commons, it probably would struggle to succeed if it didn't have an organization around like Branch Services.
Fantastic. You talked a bit about the importance of supportive housing. Can you maybe elaborate on that a little bit, particularly as it relates to individuals with intellectual and developmental disabilities?
Yeah, I think there's a real increasing problem facing the country, but most acutely here in Northern California. Right now, and again, it's hard to get these statistics, but if in the Golden Gate Regional Center and the San Andreas Regional Center, the general numbers look to be getting close to 75% or higher of adults are living in their family's home. And generally, in many cases, that isn't by first choice, it's by default. It's very difficult to find an affordable unit. Even if you can get an affordable unit, there's many people that are in it that can't get service provisioning that they need, even though they have budget. And as you know, the unit economics on community licensed care facilities or group homes has been under a lot of pressure, and is in many cases, organizations, if they didn't get some scale like LSA, are in difficulty, and a number have closed. So while the demand is going up in our area, supply is either flat or in some cases even going down in some areas. And so I think the challenge is, how do you change that trajectory? And as people age, it's obviously a concern for any parent or sibling. And so I think it's trying to figure out how do you help on that?
Yeah, good points. Tell us a little bit about your personal journey and what led you to spearhead this.
Well, yeah, thanks for asking. So, I've lived out here since the early 80s. I'm married to a wonderful woman, Patty White. We have 4 children. Our youngest, who's 25, is Amy. And she was born with Down syndrome. She's doing great. She went through the local Portola Valley school system from kindergarten through 8th grade. We have a lot of extended family back on the East Coast. And when we'd go back in the summers to visit family, we got connected with some of the different kind of service providers to keep up with her reading and other skills, and really got pushed to look at a program or a school on the East Coast in Massachusetts called Riverview. And some people may have heard of it. It's one of the oldest kind of schools to help with people who have different types of learning or developmental challenges. There's actually not many people there with Down syndrome. I'd say it's 2% of the maybe 200 students. We actually got convinced to put her into a summer program, and that sort of led us to doing a bit of an assessment. And at the middle of 8th grade or going into 9th grade, we really were convinced that for her, best thing was to go to school there for high school. She was becoming very socially isolated, even though our school district had been pretty supportive, and we'd had a very good experience up until then. But she was getting very socially isolated, and she's a pretty social gal. The reason I talk about Riverview is they would start a family, what's called transition weekend once a year in the wintertime. And they would bring in people who had finished the program and would talk about the transition from school systems out into, being in the real world. And it was pretty eye-opening and, in fact, pretty scary to learn that. We did that for a number of years. But one of the great things is they had a lot of different, and people come from all over the country to go to this school. And so you see housing and work programs and service organizations from around the country, which led us to do a little research and then come back and really look at what are the options here on the peninsula. And, I think we saw a gap between what some of the, what some people would point to are some of the more interesting, innovative programs and what was happening here. And so that really led us to this, not a concept that we came up with, but we've seen in several other areas called an independent apartment community, which we thought would be a very interesting thing to try to have here in the area. And more importantly, be able to show the unit economics of how that might actually be something that helps address some of the root problems here of quality service delivery and other things that I think are challenging the two kind of core choices that generally you're told to go do: find an affordable, unit, or, go into, a community licensed care facility, or just, you're at home, or get a market rate. But unless you're, financially, really well off, that's a very hard thing to do on a long-term basis. So that really became the journey, as you asked, of how we kind of got there. I don't think we were really looking to get into like, how do we go build these things and start service organizations, but I think we felt that you could do a existence proof here. And then the question is, could that lead to other policy changes or things that might lead to a more scalable set of opportunities and solutions around?
Well, it certainly was a big undertaking. Maybe you could just kind of walk us through the stages of development, right? This isn't something you do in a year.
Yeah, I mean, and look, so Dana here was, I'd reached out and called, and he took my call, and we talked a lot, and he would share his fundamental models, and we would drill down on that. And we really did a lot of research. I think the journey is, once you kind of have a determination of, you got to decide kind of at what level, what you're trying to design for, who's it for, how many people, why. Once you have that, then you can start thinking about locations, and location could be a long discussion. I for one think that you do not necessarily have to be by a transit-rich area, which is what most advice you would get. I think we're going to be entering and again, most of these you're taking a long time horizon, multi-decade in a housing project. I think in the next 5 to 10 years, there's going to be a lot of different transit opportunities with autonomous driving and other business models that come out of that. We decided to first do this project, in Portola Valley, which would be, most people would view as not a great thing. There's no bus service, there's no, train service. But if you look at it, it actually hits most of the things that you really need. There's a lot of employment that are all within walking distance. There's lots of core services, from grocery, doctors, haircut, you name it. And there's a lot of kind of entertainment, from the ability to, if you like outdoors. And so I think you got to decide what it is, where it is, and then it gets into the lot, how you're going to finance it, How do you get it entitled? I think there's a lot that has been new paths for, I think, more straightforward entitlement of how you can get a supportive housing project approved in a very straightforward way, whereas 5 or 10 years ago, these could be very contentious entitlement processes. And so I think any place where there's single family housing, I think, we can share our template, but there's a really straightforward legal way to get what's called a by right or a ministerial approval for a multifamily permanent supportive housing, which is a really fantastic way to do it where it doesn't have to go through a subjective process. So I'll stop there, but I mean, it's probably a 3 to 5 year project. And there's no magic to it. These units cost like normal housing. The great thing that's going on right now is cities and counties really need these type of units, and they're really starting to have funding that really was not that much around in the last couple of years. And it takes a little longer. Sometimes there's strings attached, but this is where you're actually bringing something that they want, and there's some ways to make sure that helps your project.
Yeah, you talk about the importance of support and a supportive environment. I mean, how did you build that in?
Well, really, Willow Commons is a independent apartment community. So just I think of it as, there's a landlord business that's leasing these units, and we'll lease them at somewhere around $1,500 to $2,000 a month. It'll include all utilities and some basic services, but not the supportive services, not the vocational services, not the behavioral services, not the services that you really think of when you think of your individual plan with the regional center and the budget associated with that. That's independent. You make your own service decisions, how you do that. Now, I think most of these independent communities end up almost exclusively using one service provider, or very high percentage, 80 or 90%, because there's such obvious leverage to having one service provider is working across a number of these different clients in the same physical environment.
Great. I love the fact that you've built in a coffee shop, and I'm assuming that this will provide a lot of supportive job training. And I mean, tell us a little bit about that.
I think the vocational side of this is just an interesting story. So, we went and talked to, in advance of this, almost all the major employers out there. So there's the Woodside Priory School, there's the Sequoia Adult Retirement Assisted Care, there's the Portola Valley School District, there's Alpine Hills Swim and Tennis Club, there's the Roberts Market. We went and talked with all of them, and they all have a common problem. They really struggle having what we call a loyal local workforce. And so what you're able to do, we have two kind of what would be like two LSA homes that are being run nearby on a same cul-de-sac. So we've got about 8 live-in residential folks there in the Thistle houses, and we have about 15 to 20 kind of day programming. And what we've been able to do is create job specialists. We've created a trial program where any of the folks involved with our strategic employment partners will spend 2 to 8 weeks working in a variety of roles, and where they find a mutual fit in where the skills and interests match. And we really job coach that up we really have helped both the managers and the residents get really clear, honest feedback. And, we're being asked for more employers. I mean, the employees, this has really turned out to be a great thing. It's been a good fit for the folks that are working there, and it's been a great fit for our residents. And so the coffee shop was really two-pronged. One is, sadly, there's not really good coffee shop in Portola Valley. There's a lot of cyclists and runners and hikers, and we think there's an opportunity there. So the idea was, how do you bring community in, and so you have highly integrated environment? And for those who would like that type of job environment, we have the ability to create job opportunities that is being run as effectively a nonprofit within the Willow Commons apartment building. So there's a 800 square foot small cafe. Think of it as a high-end espresso coffee shop with a big outdoor patio that we think is going to be one of the community hangout areas when that's really running. And we think it's partly how you really make both people, comfortable being around this environment and welcomed in the environment.
It's fantastic. I'll have to program it in as a stop, because I'd certainly love to support that coffee shop. There must have been some incredible challenges along the way here. Maybe you could share some of those and how you overcame them.
Yeah, I mean, sadly, there's a lot of great new laws that have been created over the last 3 to 5 years, but there's not a lot of precedent in how people have leveraged those. So we used AB 2162. It's the California Supportive Housing Law. It's a really wonderful law that's been expanded. It really was originally started for homelessness, but people with intellectual and developmental delays are viewed as part of a targeted population that is covered under the supportive housing law. That opens up a lot of avenues of how you can do these projects. But to your question of challenges, I think we've ended up having 4 lawyers working with us that bring different levels of expertise, from land use, entitlement use, whether you're using density bonus law or supportive housing law. And I was talking to one today where we're having some issues with one of the state agencies. Even though the town's approved something, someone else comes in. I would say it's well spent money to find the right specialists around this. There's all these unique rules called the setting rule, that you need clear reviews of your documents, your lease agreements, your operating, house rules, things like that really are important. So I think it's conflicting and complex rule systems that don't always even align. You have to, deal with conflicting groups. I mean, the housing organizations are different than what are, that come through the regional center and the Department of Developmental Services. They literally have conflicting requirements. And so how do you work through that?
I mean, you and I have talked a lot in those days about, scalability, because it is a bigger problem. And gosh, wouldn't it be nice to be able to scale some of these solutions? What advice would you give to someone who, wants to do something like this?
Yeah, I mean, I think you got to probably find a few families that want to be partners with you on this. I think it's a hard journey to go do on your own. It's a ton of work. There are some groups that are trying to provide, real advice and are trying to do this in a more replicated way. So especially on bigger projects that use sort of the big state federal funding through what's called low income tax credits, or and so the Kelsey, Eden House, Mid-Penn housing. I think if you're serious, those are worth talking to those folks about projects that are coming up and how you could help them on set-asides inside of those projects. I think, finding ways as you've done with families that want to go expand the licensed care housing footprint. I do think we need to figure out how to do that more often. I mean, kind of the Thistle houses fit that. We did it in an unlicensed way, in the sense that you could use SDP and it was independent housing. And there's some, I think, interesting advantages to that. But so I think, those are two easy ways to ride on the rails of where either existing housing exists, or bigger projects that are looking for advantages that might come with some help from some folks that want to help on set-asides in bigger affordable projects. And then, for the more projects like Willow Commons, there's generally, you're going to have to find some charitable support or have some capital. That we have support from the Santa Clara County that's contributed money. Our town's contributed money to it, but at the end of the day, it still requires a lot of capital to make one of these projects go. And I just make the last point, even though that's expensive, I think the challenge is that I still think services way outweigh the total dollar cost that will be spent on any of these projects over a 20, 30, 40-year period. And so you really have to get the services right and have the services around that would support a project like that, which I think is still why branch services, kind of got created.
Yeah, I mean, we often say, it's a housing crisis, but a house without services is not a solution.
Correct.
So, well said. You mentioned self-determination, and that's relatively, as a service option, it's relatively new. And it seems as though that has been very helpful in being able to fill some of those gaps. We're going to have self-determination as a topic in the next one, but your perspective on that, you called it.
Yeah,
SD.
so I think, I think the timing for some innovation in this, again, permanent, affordable, supportive housing is really ripe. And elements of why that is one, there's clarification around what the setting rule is. The setting rule, which was, you didn't want to have congregate living, trying to avoid the mistake of decades ago when there was institutionalization. And but there were some advantages to having some scale, and the real objective was to have people really fully integrated in the community. But how do you get some of the advantages that came from having specialists and skills and redundancy and all the things that came where you had some scale around what you're doing? So setting rule clarification now is very clear. You can do projects like Willow Commons or others that are around the country and in the state. And secondly, I think is really another potential real unlock to innovate is the self-determination program. And again, for those who don't know what that is, that's where you as a family or your son or daughter that's the client of the regional center can decide that they would prefer to provision their own services off of their individual personal plan and budget associated with that. And it's a pretty onerous process. I I don't believe it should be as onerous as it is, but not many people in SARC or GGRC have successfully been able to get through that. I think at GGRC, which I'm more familiar with, I think there's only 75 people out of the whole GGRC that have successfully gotten through the self-determination program to be able to make their own service provisioning decisions. But the real advantage is, and the reason it exists, is people were so frustrated that they could not get services, they couldn't do things that were just not, that were a little off center, or they had ideas of what they really would be the right thing to do. And so it was to give the choice of having more service innovation happen around that. And I think it's a great goal, and I think it's really needed. And so branch services and what we've been doing with Thistle have been innovating around using the self-determination program to, I think, deliver a very high quality level of service by being slightly different about how the type of people you hire, how you run that. And it's not perfect. It's got its own, pluses and minuses, but I would say the big differences we're starting to see is, I think in the 2 years that it's been running, we've had virtually zero regretted turnover, which in the kind of service organization worlds for our community, that's extremely low. And we're able to also invest pretty heavily in the training and development, given you're not going to lose this person in 6 or 12 months. You can invest in training and career development around that. So all this is a long-winded way of saying there's been a number of clarity decisions in self-determination, in setting rule, and I would say just broadly the California housing crisis, that if any of you have been involved with your town's housing element, you would have seen how much emphasis was being put on fair housing, housing for targeted communities like those with intellectual and developmental delays. So there's a need and a kind of a win-win with towns and counties right now, where I think the projects that we can bring forward are really attractive for a whole bunch of reasons that help satisfy requirements that they need to do. And therefore, I think you can get a lot of leverage both in financial support and other, entitlement ways that I think was very hard to do 5 years ago.
I mean, kudos to you and your wife and all those that have been involved in making this happen. Pretty amazing. I think we'll wrap this up right now. I know there's some questions popping up left and right, and we'll continue the dialogue, but we'll pass it back to you, Adia.
Yeah, that's great. Thank you for the amazing discussion. I know a couple of things have kind of been interwoven in your conversation, so we're going to ask them for clarity, and then also to make sure that as we're transcribing this blog, which this webinar, which all of our webinars are being transcribed into blogs, that we have it for posterity reasons, the official answer, at least from Jim White's mouth, and to our website. So that being said, I do want to thank you for the conversation. Already it's sparking a lot of interest. If you're out in the audience and you want to ask a question, now's the time when we're going to start our Q&A portion. You feel free to put your Q&A or your questions in the Q&A feature in this Zoom application. And we should be able to ask that just shortly. Before we do, I think that, Jim, one of the things that we always ask is, how can someone like me, how can someone who's an advocate for this community and a fan of Willow Commons and branch services, how can we support you currently with what you're doing?
Yeah, that's a great question. We've just been heads down. I think I am worried about the regional centers, being forthright about the issue of, as people age, where their choices are when parents begin to not be able to care for their adult children. I think there's a bigger crisis there than that we're really seeing. So I'd love to see more data transparency of, where people are living, how many people are doing that by choice versus they have no other choice. I do think that, the other thing is I think we need more services broadly, and we need more service innovation, and we need more ability for people to really have a career around this. And I think both from working with the community colleges and training and what, and how we make that a path that's financially works and skill wise, I think is a really important thing that we're starting to talk about.
Wow. Okay. So then what I'm hearing you say is advocacy, advocacy for data transparency at the regional level. And then also for the reality of the IDD population aging in place. What are the real costs behind that? Is that what I'm hearing you say, Jim?
Yeah, I think it's at the point of the real crisis is the people have no choice on where to live, and the aging parents can't take care of their adults. I think that's a really acute problem right now.
Thank you for saying so. We do follow up with these things. They become topics and initiatives here on the marketing team as we focus on that particular branch outside from brand awareness into advocacy and that next big dragon to slay. So thank you so much for sharing just the thought leadership. Let's get into a couple of these questions because I know they've come in now. I know before we settle on that, I do want to just quickly touch with Dana on some of the things that we've seen based on what you just said, Jim, and our viewpoint from LSA standpoint on the crisis that's forming with people aging in place. Dana, can you talk a little bit from the perspective of LSA about that and the need for housing and some of the things that you've seen?
Yeah, sure. I mean, a lot of what Jim said absolutely resounds with what I've seen. I am a parent. I do talk to a lot of parents. Most parents, want to keep their kids home and safe, and they do that until some cases they can't. And so, it is a problem that builds. I also think a lot of parents come to realize, whether it's through placing their child in a Willow Commons or in an LSA, they find out that they actually thrive when they're out of the family home. So it's not just the eventuality, but it's also the in-between and what it means potentially to the life of the family, both inside and outside of the family home. Yeah, so I think there clearly, it is an unsatisfied demand. It's hard to quantify. Sometimes people, don't realize themselves that, and we'll get a referral. It'll be for a not so young man who's now 65 and his parents are, pushing 90, right? And so I think it's a real problem. It's not one that the regional centers particularly want to deal with because it's not easily quantifiable. And I think, and this isn't said, but the kindest thing on the budget is living at home with mom and dad.
Yeah.
And, if you went from 75% living at home to 50% living at home, it'd be a huge swing, and we would immediately find massive shortages in not only the physical houses, but also the support services. And
Right.
as we've all learned, those are just as difficult a problem. And I think Jim nailed it on the head. Until you can make it, um, a career path that you can pay, respectable wages for the very professional and expected services that will be provided by those individuals. You find yourself competing with the wrong kind of options that when people are looking to make those kind of employment decisions.
Exactly. And thank you so much for saying that. I do want to take some time to get into these questions. And as promised, we are going to answer your questions on air. But thank you, Dana, for saying that. And thank you, Jim, for also highlighting that. Because it's not something that we necessarily try to focus on in our storytelling. We try to focus on messages of hope. But then there's also the bigger issue, which is what is the problem? What is the size of the problem? And so I appreciate hearing both you, Dana, and Jim just talk about the problem, as well as what some might call opportunities for solutions, especially if we were able to scale in your case with Willow Commons and with LSA. So let's get into a couple of these questions. So Lisa, thank you for asking your question. Lisa says, does your vision plan include, so I'm assuming this is for Jim, does your vision plan include individuals who require SLS and 24-hour supervision, or is it only ILS or independent living services? Also, how are you addressing the issue of ensuring affordable care? My understanding is that there's a scarcity of providers for both SLS and ILS. So this directly talks to, again, the shortage that we're having with DSP workers and so on and so forth. Jim?
Yeah, so let me piece that apart or tease it apart.
Sure.
So Willow Commons is an independent apartment community. The admissions process will be run by an admissions team. It'll be well documented. You need to be a client of a regional center, and that's the definition that you are eligible to be in the supportive housing from the entitlement standpoint, in the entitlement agreement. The admissions process has a set of kind of house rules that you need to meet, and just like you would in going into a community licensed care facility or something like that, you'd go through an assessment and have a number of things that would just help verify that you can live and meet the house rules and to live independently. If you need ILS or SLS, you'd need to show that you actually have that in your IPP, and that you are budget and access to that, so that you can successfully live there. Willow Commons, because of the setting rule and the regional center, really require a complete independent separation of services in housing. So you have a lease agreement with, if you're given admissions, you pay a lease just like you would rent an apartment. You'd sign a lease that has a set of house rules that you need to meet, community rules, and you have a monthly rent. The objective of the rent is to keep it as low as possible. It's deed restricted for 55 years at low income housing, but because our area median incomes are so high, that's actually quite high. I mean, the rents could be $2,000 a month if you wanted to. We haven't set them. It won't be that high, but you have to really make sure you're covering your costs and some other things that are going on there. so that it's sustainable on a long-term basis. The right reserves are being made and all that. So that's the housing. And so, if your son or daughter, just requires ILS, they just need to have that in their plan and, budget, and that's valid, and meet the other admissions requirement, and they choose who their provider is. But, on the peninsula, there, it can be slim pickings in areas, especially in SLS and sometimes in ILS. So that's part of the reasons we helped encourage the start of branch services that's primarily focused on SLS and other services around that, to begin to help scale that up, so that when people move in there, there'll be one provider that we know is around that can provide some of those services.
And I think some of the other questions too kind of dovetail right into that. If I was, highly paraphrasing, a lot of people want to know, what is it that you're doing to get your staff to stay? You said there's been relatively no turnover. And someone asked, they said, Jim, you said you have not had turnover in support staff for Thistle Homes. Pay scale for support staff are generally low. What do you see attributing to no turnover in this staff, and what helps staff stay? Which is a great question, $1 million question.
So you could kind of compare a Thistle house. This is just, again, think of it as an LSA house that has 4 residents, in our case, living there. You might have a few more in some of the LSA homes, which each one of those residents that have decided to rent a room in that house, so they're living in a shared living environment, but it's independent leases. And just like in Willow Commons, each of them are making an independent decision on an SLS provider. So what's different is, because we're leveraging the self-determination program and SLS budgeting, we're able to pay a higher rate than what the reimbursement rates are in a community licensed care home around that. Now, it gets complicated, but we're able to leverage some shared services across that. This is where I think leverage comes in, that allow you to do some other things that make it not just an apples to apples, but really an apples to oranges comparison, because you can begin to do some other things with the SDP and SLS, like and community budgets that come with that. So I'd say that's the big difference. The physical house probably looks identical, the same but we're running a different business model effectively through it that allows a higher rate to be paid. But, each person is probably getting effectively a slightly less set of hours on paper, but you're kind of getting some shared services that make up for that.
Yeah, we know a little bit about that. Dana, do you want to talk a little bit about, I know you can't give us everything, right, in one setting, but we've had pretty low turnover in comparison to some places. And Jim spoke earlier about us, being one of the ones, the LSA being one of the ones to scale in a time where doors are closing because of lack of services.
Yeah, and just to be clear, I'm sorry to interrupt. LSA is, I think, one of the best operators out there. When I went and benchmarked and looked at all these organizations, I think what they've been able to do is leverage both staffing, training, back office, across that. If you're just running one home, I think you're really struggling right now. If you can't get some of that leverage. And I just want to be clear that, there's a reason Dana was asked to be on the board of Branch, and we talk all the time. You guys are doing great stuff.
Yeah, you're a smart man, Jim. I will say that. Dana, do you want to speak a little bit to that? I know that you got pulled into the board of Branch Services for some of those reasons. Can you talk a little bit about what our secret sauce is? How are we doing what we're doing?
Yeah, I mean, and I think leverage is certainly first and foremost one of the things that we're able to bring so that we can essentially take advantage of our scale, without diminishing the quality of the program. And along those lines, I mean, I kind of come back to, when I first joined LSA and I started to understand what a licensed residential care home was, and, looked at the 500 pounds of paper that represented the regulations, I thought to myself, there's got to be some way to simplify this. And all I could do is come up with, we need to figure out how to make this a great place to live and a great place to work. And so I think once you get clear, and a lot of it kind of comes back to supportive services. And I think this is also one of the things that Jim's got going for him is these individuals, work in a work environment that's a home, and they get a chance to, develop relationships with the people they're supporting. And I think that's a very positive motivator for everyone concerned. And it's part of the reason why I think we experience low turnover. It's not to say that there aren't challenges, but, when we first got started it and opened up, 5 additional homes, we had to hire like 90 people in 90 days. And I came up with basically one criteria that we had to figure out in the interview. Is this someone who is a inherently caring individual? And will they get satisfaction out of caring for someone else? And if you can figure that out, you're a big way down this, the path. So you have to essentially create a great environment, be able to run the business in a very efficient way, to be able to manage as much of the money you're receiving in rates to wages and benefits. More dollars that end up, lost on the way and don't end up in somebody's pocket, the more you're going to struggle over time either to be sustainable or to invest in people, because it's people that make the program.
Yeah. Thank you so much for saying that, Dana, because as a back office or office employee, it's certainly true of all my coworkers. I think that we all have one thing in mind, which is a caring and compassionate heart, and it's genuine, not just for the individuals we serve, but for those who we work with. Kind of a requirement for working at LSA.
One more comment I'd like to add to that is that, I used to say to myself when I get up and go to work that my only job today is to make sure that I'm making our people successful, right? Paying them on time, paying them accurately, making sure that their life, isn't distracted by things that don't contribute to the end product, which is the quality care and programs.
Yeah, and it's been a great place to be a part of. That being said, there's quite a few questions that are in the question and answer queue right now, and I'm gonna rapid fire them off to try to get through as many of them in just the few minutes that we have left, while with all the other things that I have to share. But a few of them, Jim, can you tell us how parents play a role in the IDD residents' lives?
Yeah, and I actually see the questions here. I can crank through them real quickly if you want.
As long as if you do, you make sure you read the question first so we can pick it up.
Okay, yeah. So parents, it's up to the resident. There's no requirements. It's really an independent apartment, and that's their choice. I will say in the the Thistle House is the parents have been pretty involved. They do some community dinners and a whole variety of things, and that's been great. And I hope that's the case at Willow Commons. I think that if that's the Mark Jackson I know, I see a bunch of questions about unit economics. So he also asked, will there be an on-site executive director or program manager? Again, Willow Commons is really not doing services. There'll be we'll have a property manager, but, think of it as an apartment building that, would have a property manager and deal with rents and, property management. Willow Commons does have, or branch services does have an executive director. I would suspect a large percentage of the people will use that because there's just not a lot of other choices in the area. That may change, but right now that would probably be the likely service provider. The woman running that, Brenda Paczecki, I think is a really strong executive director, a great leader, a huge advocate for for adults with intellectual and developmental delays, and I think is doing great work. So she'll be super involved. It would be my expectation, and we'll probably contract out some programming things to Willow Commons to do things for the Willow Commons property management for services that are provided.
Absolutely. Jim, I'm gonna stop you here. I know there's more questions left. We do try our very best to keep it to an hour. While I'm saying that, it's been an awesome conversation so far. We're not going to leave you hanging. We have some information to share with you, and Jim has his contact information so that you can continue the conversation with him. If you like to ask your question, you are welcome to ask him directly. He's left his email for us and his LinkedIn. We're also going to make sure that we put that in the chat. My team will put that in the chat for everyone right now. And then, of course, this recording will be available on our website and on YouTube after this recording tonight. So that's another reason why we want to try to keep it to a crisp hour. That being said, Jim, Dana, I want to thank you so much for joining us tonight. It's been a very, very interesting and informative conversation that I can't wait to go back and listen to again. That being said, if you are still hungry for more, there's just one last series left. We alluded to it already. Our next and last webinar in this series will be available and it's open for registration now on our website. The link's here on your screen, as well as if you go to lsahomes.org, you can register for this next webinar, which is Navigating Self-Determination at San Andreas Regional. So that's SARC, and navigating the self-determination program. We're going to have Lisa Hartley, who is a self-determination specialist at San Andreas Regional Center, joining us next week at our normal time, which is 6:30 p.m. Pacific Standard Time. And if you register today, then you should be ready to go for next week. And also you'll be able to hear a little bit of the previous talks if you go to our lsahomes.org. I'm excited about that and you don't want to miss it. So please do register for that. And then if you're willing to join us in person, we're going to be doing a race for LSA, and this is our annual race. This is our 4th year doing it. We're going to be at Vasona County Park, and we'd love to see you there, where you can run, walk, roll, or stroll, and just come out and cheer on the finish line. That's September 14th. It starts at 9 a.m. Register down at that link or the QR code and let us know that you're coming. We'll be excited to see you. As always, you can connect with us and continue the conversation or ask some of your questions at lsahomes.org or info@lsahomes.org is our email. We answer that directly, so we'll be excited to hear from you. And you can continue on a conversation on any of our social channels or on all the major ones. Thank you so much for joining us tonight. Jim, it's been an absolute pleasure.
Yeah,
Thanks.
thank you so much, Jim, for all of your insights and for all of your work in support of this community.
No, probably it was great talking, and as always, I appreciate all your help, Dana and Hidea. Thanks for putting this on. This was great.
Much appreciated. And for all of you for joining us tonight, we apologize it kept you a couple minutes over, but thanks for the lively discussion and for your questions. We'll see you again next week. Thanks so much. Bye for now.
Good night, everybody.
Good night.